Um, right, this is a bit of a last-minute assumption of responsibility, but I hope I'll be able to live up to the expectations. I'm sure many in the room already know the nature of the attack on the NHS. As Wendy Savage said this morning, there's a double whammy coming down on the NHS. The first is a demand for £20 billion of so-called efficiency savings, which is actually carried over from the last Labor government. They decreed that there should be £20 billion in so-called efficiency savings, and this government is carrying it forward. It's combined with the terrible ramifications of the Health and Social Care Bill, which is now galloping through Parliament. And we can't exaggerate the impact that this bill will have on the National Health Service in two crucial areas. And the first is the removal of the duty on the Secretary of State to provide universal health care. This is an absolutely historic change. This turns back what was enacted at the founding of the welfare state in 1948, where the responsibility was given to the Secretary of State for Health to provide universal health care throughout the UK. It means that the state no longer provides for all its citizens, and it removes responsibility for health care from society as a whole and devolves it upon the individual. The second major impact of the bill is the throwing open of the NHS wholesale to commercial healthcare companies. It's throwing open the doors and saying, come in and help yourself. And unlike the Secretary of the State, the private healthcare companies are not democratically accountable. So if they provide you with a crap service, you have no recourse through the democratic structures of this country to do anything about it. In this, the bill follows the neoliberal agenda, which in its essence is the removal of responsibility for essential services from the state to the individual. And the weaker and more vulnerable the individual, the less likely they are to be able to cope with such responsibilities. Ensuring that private companies are providing these services mean that we as individuals have no control over our own services. The Health and Social Care Bill is the culmination of 20 years of lobbying by the big commercial healthcare companies, which has involved 20 years of major restructures to create an NHS market so that the commercial healthcare companies could find a foothold and come in and get their feet under the table. The underlying aim of these 20 years of restructuring, which has culminated in this Health and Social Care Bill, is to set up a health service in this country along the lines of the one provided in America, which of course everybody here will know that it costs far more than the National Health Service here and fails to provide for 53 million citizens of the United States. And in fact, I was at the national conference of Keep Our NHS Public a couple of weeks ago, at which an American spoke who had worked for 20 years for two of these private insurance companies in the US, and he explained how their function was not to provide health care but to deny health care, to find all the reasons in the world so that they can make a profit. It's how insurance operates everywhere in every service or system. They have to find a reason why they don't give you the insurance in order so that you can get the private health care. And this particular speaker, Wendell Potter, I think his name was, he came from the Appalachia, and he had he moved away from his roots in that sense and got very good jobs with these private healthcare companies and done well for himself. But he said what was an epiphany for him, an awakening as to the brutal and inhuman way that this, one of the most advanced capitalist countries in the world, treats its citizens, was that he went back to visit and he heard about a local free healthcare fair, which was provided where they hold the state fairs. And it's a scenario which happens where doctors and nurses and other healthcare professionals volunteer, and they turn up, and all the people who either have no insurance, no health insurance, or not enough health insurance, turn up, thousands of them, in order to be treated for free by these doctors and nurses. And he said he saw people who were in the pens for animals at this state fair, huge building, who were being treated, and this was such a shock to him that he then started to campaign against what these private healthcare companies are doing. But that is the future that this health and social care bill, if enacted, if carried through, will be imposing on us here. This, I mean, as I said when I started off, we can't exaggerate the significance, the importance of what this bill is doing, and the essential, absolutely essential thing that we have to campaign against this. We have to organise and gather all our forces to oppose this and turn back this bill. It's no coincidence as well. I spoke about the 20 years of lobbying by the commercial healthcare companies, and it's no coincidence that at the same time came the attacks on the unions in this country, and the major defeats of the unions and the imposition of the draconian, severe anti-union laws which prevent our unions from standing up and, for instance, opposing, coming out on strike, taking industrial action against privatisation of public services, and prevents our unions from being able to show solidarity by, a union which isn't involved in the health service saying that this is an essential, so we have to have this, we have to have our public services, we're not, we haven't got an issue, but that we demand the saving of our public services, so we're going to come out on strike. This can't happen under the anti-union laws that have been imposed over that 20 years on the trade unions. And as I say, it's no coincidence that these two, the privatisation, the break-up of the public services, and the attacks on the trade unions, the driving back and the defeats and the imposing of these anti-union laws, and now, of course, more talk about even more severe anti-union laws which will prevent us from defending the welfare state and public services, which is, of course, the big, this is what we're coming into. Everybody's now, anybody with an ounce of principle or who needs the welfare state is now coming forward, thinking seriously about all these things. And, this is what this conference is about today. We're coming together around all of these issues to challenge and to organise ourselves and to, and to win that fight. But I just say here that because of that, the way that the privatisation of public services, I would say, is a result of the attacks on the trade unions, the drive and the anti-trade union laws. That is what is enabling it to go ahead. And so I would say that any political party that does not have right up at the forefront of its what its agenda is, to say that we must overthrow these anti-trade union laws, any party which does not have that as part of its manifesto, and the first thing that it does, that party is not standing up for the NHS or for public services. And I say that in particular because I went on a number of marches and demonstrations and so forth before the last election, on which were Tories, Lib Dems, Labour Party, all the smaller parties, all marching together and all saying, you know, we will defend the NHS to the death. But if any party which says that and then does not say in the next breath, and therefore we must abolish the anti-union laws, is full of, what shall I say? Shit. It's full of shit. So we, included in this attack, of course, is also, and looking back on the trade union actions, the strikes on the 30th of June, one of the huge issues, which of course is emerging, is in terms of the privatisation of the National Health Service, is there is coming up a massive attack on pensions, because this of course is what makes the NHS workforce so expensive, is they have, you know, of course they're still holding on to these very good pensions, and in fact even when they're tupied across to the private healthcare companies or the voluntary sector, they are still holding on to these pensions. So the talk is, with all these foundation trusts, which is part of the Social Health and Social Care Bill, is that every hospital must become a foundation trust. They spin off from the NHS, become independent, they can set their own wage levels, and of course they are talking now, the organisations, about getting rid of the pensions. So all of this, it comes together, it's all coming together, all of these issues in terms of a perfect storm. Wendy talked this morning about the campaign that the KONP is carrying out in terms of the MPs, lobbying MPs in Parliament over the summer break to try and get them to vote against this bill when it comes back in the autumn. I am the Secretary of the Hackney Keep Our NHS Public, which has been very active over the last 6-7 years, and we've organised a local coalition to save the NHS. So we've gone into coalition, joined up with a whole array of local organisations, including the Hackney Labour Party, Hackney councillors, the local BMA division, which covers the GPs, consultants in the local hospital, the hospital workers, the Green Party, the local National Pensioners Convention, the local patients organisation, the Hackney Link. So we all joined up, we formed a coalition together. Coalitions all over the place. I think the more the merrier, and you know, the more that we can sort of link up and, you know, all together, so we form one gigantic coalition which then can carry the whole fight forward, the better. So we've organised this local coalition, and we're organising, because we're stronger, you know, obviously together with all that, and we've got all the networks of all those organisations, and they can bring their people and so forth. So we're organising a local demonstration on July the 16th, which is Hands Around the Homerton, against the Health and Social Care Bill. We're calling on all the Hackney's local community to come down to the Homerton Hospital, which is our beloved local hospital, and link arms around it to say that we love our hospital and we love our NHS and we will not let them go. And we're sort of, you know, giving this as a shining example to everybody, you know, why don't you do this as well? Organise a local hugger hospital and, you know, publicise it and so forth, and get some media attention, and also get the local community involved as much as possible, so they know what this bill is and what it's about and what the significance of it. It is, as I've said twice now, and this is the third time, it cannot be overemphasised how significant this bill is and what it will do to the National Health Service. And just as a sort of postscript to say that my union is Unite, which was involved in or leading the way in organising that march on last Tuesday for the NHS. But my union has thrown itself enthusiastically into this, the anti-cuts campaigns, and is working very hard to get all its activists involved. I'm the chair of the Central London Area Activist Committee of Unite, and at our recent rules conference we had 2 significant rule changes, one of which was to create a category of membership for students and for unemployed people, so we can now bring them into our area activists committee organisations, you know, as representatives, and encourage those people to become part of, and our members to join with them to become part of this fight. And we also changed our rules so that we call 4 mass meetings a year in each of the area activist committee regions, so that we bring in not just the committee members but all of our activists to come together and talk and discuss and work out, you know, how we get actively involved in the anti-cuts campaigns and support and help each other and send that support down through the union to the grassroots activists, to ensure that they're involved, you know, with their full strength locally. So that's a bit of a slight bit of a rag bag of,
no,
of all sorts of things, but I'll finish there and hope to get some.
For those of you